Good morning, y'all. I'm Alan. I want to thank you for joining our Revolution South Carolina January meeting. Please introduce yourself in the chat with your screen name and the organization you are with. Put questions for the panelists in the Q&A. Today we will continue discussing healthcare in South Carolina with our special guests, Mia McLeod, Joe Cunningham, and Gary Votour, the 2022 South Carolina Democratic candidates for governor. Our guests today will face off in a primary to be held in June 2022. Today's forum is not a debate. It is simply a chance for the candidates to inform us on their plans to improve health care in South Carolina. Mia McLeod is currently the state senator from District 22. Prior to that, she served in the South Carolina House from 2011 to 2016. Mia has a law degree from USC School of Law. She is a seventh generation South Carolinian and a small business owner. Joe Cunningham served as South Carolina's first congressional district representative from 2019 to 2021. He was the first Democrat in over 40 years to represent the Low Country in Congress. Joe was successful in having two of his bills signed into law. Gary Votour currently lives in Northeast Columbia. He has been active in supporting healthcare, previously working with Indivisible and the Poor People's Campaign. We've got quite a few people joining the call. We've got George Fleming from York Democratic Party, Pamela Coyle, MD, and I'm sure we'll have a lot more coming in here pretty quickly. We had Dr. David Keeley, who is integral part of our message about healthcare in South Carolina, is on the call. So with people coming in, let's now go to Lucero Mesa to kick off our January forum.
Good morning. I am Lucero Mesa, co-chair of our Revolution South Carolina, and I am pleased to welcome all of you to our first meeting of 2022, a continuation of our commitment to fight to achieve our goal of healthcare for all as a human right. Our guests today are three candidates for governor: Senator Mia McLeod, my senator, who I have the pleasure to listen at the Northeast Democrats monthly meeting earlier this morning, former Representative Joe Cunningham, and Mr. Gary Votour. We appreciate you joining us today. As part of our ongoing healthcare discussion, our Revolution South Carolina continues to provide a conversation platform to inform South Carolina voters about how political decisions affect our daily lives. The struggle continues for Medicaid expansion in South Carolina and for an improved and expanded Medicare for all. We are working in coalition with PNHP. Those are the Physicians for National Healthcare Program in South Carolina, educating citizens and exposing the infamous Trump-era Medicare Advantage that is draining the Medicare Trust Fund. Many politicians are not even aware of direct contracting. Medicare Advantage is a profit driven by the private insurance companies who limit physician networks and hospital access with the purpose to deny care. Can someone tell me why vision, dental care, hearing aids are offered as separate insurance? And why we were dental and vision removed from the Build Back Better Act? Aren't the eyes, teeth, and hearing part of our bodies? It is sad to see elderly people, toothless, deaf, and many that barely can see because they cannot afford a pair of glasses. It is an indignation. It is unacceptable in the richest country. How cruel it is that people have 2 or 3 jobs to be able to survive. On top of that, those part-time jobs do not offer healthcare insurance. Can the politicians understand the impact of this on families' economical and emotional stability? This is a moral issue, period. Over 800,000 people have died in the U.S. due to the COVID-19. Many deaths were as a consequence of lack of preventive care. People die in this country because they are poor. The healthcare system in our country is a dysfunctional, profit-driven system. Join us in our effort to make it a more humane system. Before we start the conversation with our guest, we are going to hear from Hal Ginsberg with our Revolution National. Welcome, Hal.
Thank you so much, Lucero. It is always such a pleasure for me to talk to and be part of the South Carolina Our Revolution group, and it's a great way for me to ring in the new year 2022. I'm going to try to be very, very brief, but I have already spoken to all three speakers, and I just want to let you know you're in for a great treat. I've already met Senator McLeod on a previous call. She's a great ally of Our Revolution South Carolina. We greatly appreciate her willingness to come on and speak today. We also have former Congressman Joe Cunningham, and it was great to see Joe on this call. Thank you so much, Congressman, for joining us. And progressive activist Gary Votour, who has been fighting the good fight in the Palmetto State for a long time. So you all are in for a great treat, and I'm really excited, too, that we have a really nice-sized social media audience on Facebook, Twitter, and YouTube, and you can always check out the call if you missed anything or just want to rewatch it there, or just direct friends, family. Real quick, we do ask you to become a member of Our Revolution if you're not already. We call them movement builders. This is for 2022, obviously, and it's real easy, ourrev.us/scmem. I even put it in that bright yellow, so you can't miss it. South Carolina member. That makes sure that South Carolina gets credit for your contribution, and we thank you so much for your support. Real quick, 2022 is a big election year. It's the midterms. We had a really successful year in 2021 with many Our Revolution candidates endorsed. We supported them. We called for them. We phone banked. We texted. We emailed. We knocked doors to the extent we could with COVID. We had a very good result with 2/3 winning. We want to keep that going. 2022 is going to be a tough year. Get involved. We need to keep the momentum going and keep progressives in office and replace corporatists and especially Republicans with more progressive, pro-worker, pro-struggling people, pro-poor people, politicians and civil servants. And there you go, some more of our wins. Great wins in Ohio. I just want to really billboard the Buckeye State real quick. Two biggest cities, Cincinnati and Cleveland, now have great progressive mayors, and we helped elect them. So change is possible. That's a red state, and we're having great success there. So change is possible. There's Bernie. Forget about the corporatists. We've got to get health care for the people. That's what this call is all about in South Carolina, about health care and great candidates for governor who support health care for the people. We've got to get a Democrat in the governor's mansion there in Columbia. And just real quick, want to let people know our latest action here is to block insurrectionists from the ballot. Just over a year ago, we watched in horror as insurrectionists tried to and actually did occupy the Capitol for a period of time. We are challenging the constitutional right of Congress members who were involved and violated their oath of office, violated the Constitution, and betrayed the Constitution they swore to uphold. They should not be running for re-election. We'll be in Hendersonville, North Carolina, Monday. That is the former area that Madison Cawthorn represented. We want to send a message. You speak against democracy, you incite an insurrection, then you are barred by the 14th Amendment, Section 3, from running for office. And one last pitch, please become a member if you can. ourrev.us/scmem, ourrev.us/scmem. I'll put those in the link. And with that, it's my honor. If I went on too long, Keith, I apologize. Thank you so much for moderating this call.
Well, thank you, Al, and I appreciate your kind words. And the introductions, we will have the format is 5 minutes for each person to introduce themselves, and then we'll move on to some prepared questions. And then, time permitting, we will respond to some of the Q&A postings. All right, thank you. Now, Senator Mia McLeod, previously served in the South Carolina House from 2011 to 2016. She has a law degree. Her family's been in this state a long time and is a small business owner, which I think will bring a good perspective. Senator McLeod, please tell us a bit more about yourself.
Good morning, everybody. Can y'all hear me?
Yes.
Great. I just before I tell you a little bit more about who I am, I just want to say happy 2022. I know, like all of you, I am grateful to be here and to have an opportunity to not only continue to serve in the South Carolina Senate after winning my reelection handily in 2020, but also to have an opportunity to change this state for the better this year. And I know all of you are excited about that possibility as well. I was born and raised in Bennettsville, South Carolina. My mom was a public school teacher and librarian, and my dad was a small business owner. My family, as you all have said, has been in business in South Carolina now for over 107 years and counting. I'm super proud of that. I'm the only candidate in this primary with executive and legislative branch experience on both sides of the aisle. I worked for Republican Attorney General Charlie Condon just after I graduated law school, and then went on to work for Democratic Governor Jim Hodges. I've served in the South Carolina House for 6 years and the South Carolina Senate now for 4. And I'm still serving in the South Carolina Senate. So I have a record of service that is dedicated, that shows I'm dedicated to improving the lives of everyday people. And I'll tell you something else about me. I know how to win. In 5 elections, I've never lost a race, even when my swing districts were targeted by the GOP. Not in 2016, not in 2020, and God willing, not in 2022. Democrats, we've run some great candidates, but insanity reminds us that we can't continue to do the same things in the same ways. If we want something different, we've got to do something different. And for the past 2 decades, South Carolinians have suffered under a one-party rule where political courage doesn't exist and self-preservation always trumps the needs and the will of the people. Change can be challenging. I get it, but we can't, the truth is we can't progress without it. I'm running for governor because, for a myriad of reasons, obviously, I believe you shouldn't have to know somebody to be somebody in the state. I also know firsthand the struggles of those who have underlying conditions like sickle cell, like I have. I was diagnosed with sickle cell my freshman year at USC. And when I came to school, I'm, like I said, from a small town, from Bennettsville. We had a hospital that was open and running. If we did not have a hospital in my hometown, I might not be here right now. But that also has changed because we have a governor who has refused to protect the health and well-being of all South Carolinians. So my rural community hospital is now closed, and that scares me, especially during a global pandemic. I'm running because I've proven that I have the courage to lead, the guts to govern, and the experience to hit the ground running on day one. And as I said before, I'm the only candidate in this primary who has that. And with proven state government leadership on both sides of the aisle, I am confident that together we can build a better, stronger South Carolina, a South Carolina where everybody can thrive, where people can earn wages they can actually live on, and where our government cares just as much about working people as it does the businesses that employ them, where we fight to raise the minimum wage, where healthcare and public education and infrastructure are fully and equitably funded, where transportation and affordable housing are prioritized and attainable. We can do it. Where marijuana is legalized and decriminalized, where there truly is equal justice and opportunity for all. I won't get into redistricting and all of the other issues that we are grappling with at the moment, because the reality is COVID-19 should be our top priority. We are we're going through a tremendous surge and still trying to navigate our way through this pandemic without any leadership, without any direction, without any support. We have a governor who has shown that he's not willing to do anything different. So I won't get into all of that. I'm happy to take your questions at the end. I look forward to having these conversations with Joe and Gary and all of you. And thanks again for inviting me. I'm happy to be here.
Thank you very much, Senator McLeod. Now we'll move on to Representative Joe Cunningham, who was successful as the first Democrat in over 40 years to win the first congressional district for our state. Joe, please tell us more about yourself.
I appreciate it, Keith. Can you see me on here? Or?
We do. We see you and hear you.
Can you hear me okay? Okay, excellent. Because I'm just looking at this picture of myself from 3 years ago where I looked 15 years younger before I went to Congress. So it's good. It's great to see everybody on here. Good to see Mr. Votour and Senator McLeod. And I want to say thank you to everybody who's joining us here this morning. I'd like to say, while I wasn't born in South Carolina, I got here as quickly as I could. And I want to tell you a little bit about myself and why I'm a Democrat. I grew up in a very, very rural area in western Kentucky, the area where those tornadoes hit several weeks back. And it's a town of about 500 people. And it's a town and area of the state that has been traditionally very, very impoverished until FDR's New Deal came into place. It created the TVA, and it put people back to work, including work like damming up rivers, making lakes, creating hydroelectric dams, which generated cheap, affordable, renewable, and clean energy to areas that had none before. It put people back to work like my grandfather, gave him a job, and allowed my father to be lifted out of poverty, and allowed future generations to understand the importance of hard work, but also understanding that democratic ideas can make a true difference, not just for one generation, but for multiple generations. I came down to attended the College of Charleston, later got my engineering degree, and I worked as an ocean engineer for about 5 years until the recession hit back in 2008. And lost my job, lost my house, went into foreclosure, ended up sleeping on my brother's couch for a little bit before I picked myself back up with student loans, with assistance from student loans, and went to law school. Got my law degree, and I practiced law for a number of years until 2016. And we all remember where we were when Donald Trump was elected president. And I'd never been in politics. I've never been elected to office before, but I knew that I just couldn't stand on the sideline and watch that rhetoric and that behavior be verified in our country. So I did something against the wishes of many people that I talked to. I decided to run for Congress. And I jumped into a district that had not had a Democrat represent in my entire lifetime. And people told me I was crazy, that I couldn't win. It was a district in 2016 that President Trump had carried by 13 points. It was a district that Republican Mark Sanford, carried by 22 points in 2016. And even on election night, the pundits gave us a 9% chance at winning. But throughout our campaign, I stayed on the phones talking to people. We held events everywhere throughout the district. We went everywhere, talked to everyone, met them where they were. and we slowly changed the hearts and minds of people throughout the district. And we won a district in 2018 that no one thought we could win. Since then, since 2018, Republicans poured millions of dollars into our district against me. They mobilized campaigns to call my office to tell me not to vote to impeach the president. But I knew that the president had committed impeachable offenses, and I went with my heart, my gut, and with the facts, despite the political consequences. Republicans continued to pour millions of dollars against my campaign in 2020, and despite outperforming Joe Biden by 5 points and running ahead of the top of the ticket, I only lost by 1 point. We did the impossible in 2018, and we nearly did it again in 2020. But I was proud of my time in Congress and what I was able to accomplish. I was more effective than 99% of the members of Congress. And that's how I got multiple bills signed into law, including the Great American Outdoors Act, which is being called the greatest environmental piece of legislation in half a century. I lost in 2020 and I began to think about running for my old seat again. But when I ran in 2018, Republicans had control of the House of Representatives, the Senate, and the presidency. And even though I lost in 2020, I realized that the Democrats still had full control. And we're living in a state where the actions of the governor are so impactful. That's where I can make the most difference. Do things like expanding Medicaid, legalizing marijuana, fixing our roads, paying our teachers more. All these things can be done through the governor's office. And that's what I've decided. That's why I decided to launch into this race, to make the biggest difference possible. And it's going to take somebody who's won tough races before, someone who's won impossible races before. And our campaign has been off to a great start. We've raised nearly $1.5 million, and we've done all that by not taking one single dime from PACs. As far as I know, I'm the only candidate in this race to never take a single dollar from PACs. I've actually had to send checks back from corporate PACs, from special interest PACs, because I want in our donor sheets every single dollar to be accounted for, every single donor to have a face and a name. I think that's how you best represent democracy. So we look forward to answering your questions, and it's an honor to be here. I want to thank you all again for having us, and look forward to the conversation.
Thank you, Representative. All right, moving on to our third candidate. Gary Votour lives in the Capitol, and he's been supporting healthcare for quite a long time, and I'm sure he'll share some of that with us. Gary, please go ahead.
Thank you, Keith. It's a pleasure to be here this morning. I've been tasked with introducing myself briefly today, so let's just get going. In chronological order in my life, I've been a constable, a union garment worker, a cartographer, a regional planner, a community consultant, a disabled person, an artist, a small business owner, a writer, a healthcare advocate, social justice activist, a legal observer, and now I'm a candidate for governor. I've been a husband twice, once widowed. Most importantly, I'm a promise keeper. Let me explain what I mean. 16 years ago this week, my first wife, Lynn, and I walked into a big surgical hospital in Boston together. She was there to have a high-risk surgery to remove a cancerous vertebrae from her neck before it could kill her. Despite the best intentions by all, those surgeries went horribly wrong. Surgical strokes destroyed nearly a third of her brain, leaving her almost completely paralyzed and in great pain for the rest of her life. When Lynn awoke from her coma weeks later, I was by her side when she wrote, "Take me home. Don't let me die here." I promised that I would. For 6 months in 3 different hospitals, we fought to bring her home. While she recovered as much as she could, I learned how to care for her. I remodeled our home, widening doors, installing ramps to make it more accessible for her. And together, home we came. For almost 3 years, I was her caregiver as she slipped further and further away from the life we had for 28 years together. We lived in Massachusetts then, where our recently expanded Medicaid program, named Romney Care, covered all the cost of her home care and the staff that supported us and paid her medical bills. Romney Care eventually became a part of Obamacare. Here in South Carolina, our last two governors have refused a similar expansion of Medicaid. Excuse me. If Lynn and I lived here today, I could have never brought her home. The day eventually came when the pain was too much and Lynn gave up, and I had to let her go. I held her hand as she took her last breath, finally at peace and at home. Promise delivered. She made me make two more promises while she was dying. One was to find happiness again without her, and the other was to bring meaning to her death. I grieved greatly after she died, but eventually I found love and happiness again with my wife Andrea here in my new home state. I got my third degree at age 50, a master's in healthcare administration. I became an advocate for others fighting to survive a healthcare system that at times can be quite overwhelming and uncaring, as well as remarkably adept at saving lives. I've helped hundreds of people facing illness find second opinions, understand informed consent, and access healthcare when they had no insurance. Eventually, I realized that the biggest problem people face when they're ill is the lack of insurance, and to honor my promise to bring meaning to Lynn's death, I needed to use that experience to bring healthcare equity to everyone that I could. So a couple of years ago, I decided to run for governor and expand Medicaid in our state to cover those who need it the most, those who can't afford insurance. So here we are together. And I'm running as governor as a progressive candidate. I stand firmly for a $15 living wage, for giving workers the right to unionize, for defending a woman's right to make personal decisions like abortion in privacy, for a sustainable future that doesn't destroy our planet, for equality for everyone, regardless of race or sexual identity, for all of the things that make all of our lives better. I'm the polar opposite of Governor McMaster, a governor who denies people their rights to health, happiness, and hope, a governor who doesn't care about anyone but his donor base because he has no empathy or compassion for the average person. If elected, I promise to honor those commitments as governor. No one knows how much change a governor can make in 4 short years, but I promise to fight to bring change, transparency, and ethical conduct to the office if elected. I promise to make every decision as the state's highest office holder as a compassionate and caring person committed to improving the lives of all South Carolinians. I promise to bring hope for a better future to everyone. And if there's one thing that I know how to do, it's keep a promise.
Thank you, Gary.
You're welcome.
I am extremely impressed with the stories all three of you bring to us. And I can see that there's a huge amount of motivation and purpose that you can bring to the office of governor. Right now, we will move on to some complex questions, but unfortunately, they'll require pretty high-level, quick answers. In order to cover 3 or 4 of these and get on to some of the Q&As that have been submitted, please try to keep your answer to under 2 minutes. Now, first, is it accurate that each of you candidates have pledged to sign for the ACA Medicaid expansion on day 1? And then the real question is, when elected governor, what further steps will you take in efforts to expand Medicaid to cover more South Carolinians with low incomes, disabilities, and children? We'll start off with Mia, please.
Yes, you want me to answer that question now?
Yes, please.
Sure, absolutely. I will, as governor, I will expand Medicaid expansion. I will expand Medicaid right out of the gate. This is an issue that is obviously near and dear to my heart. As I said, I was diagnosed with sickle cell when I came to USC, and I know firsthand what it's like to have a pre-existing condition and to have a health insurance premium every month as a single working mom that was higher than my mortgage. Right now, we have at least, we have over 100,000 people who are falling through the gap. And we are still grappling with this pandemic, obviously. So, you know, there's never been a more pressing need or more critical time for us to expand Medicaid. To have a governor who repeatedly and consistently says the only thing that he is consistent about is doing nothing to help the people of this state when it comes to healthcare and saving lives. He is constantly forcing working people back into unsafe workplaces and forcing our children back to school, knowing that they are compromised and vulnerable to this virus. I will change that. That is something that we can change. We can expand Medicaid. We can make sure that no South Carolinian falls through the gap. That is that has been my mission and my goal as a legislator, as a community leader, and it will certainly be my priority as governor.
Thank you, Senator. Representative Cunningham, would you like to address that?
Yeah, of course. On day one, first item of business is to expand Medicaid. So not only a yes, but a resounding hell yes, Keith. That's we're one of only a dozen states in the entire country that has not expanded Medicaid, and it's all because of politics. I mean, let's be honest, it's all because of Obamacare, and I think that's absolutely just heinous and awful that we have a governor who puts politics ahead of the own health of his constituents. And when I'm governor, that's going to change. That's going to reverse. We've got to do more than expand Medicaid, though. That can be done unilaterally, and we have to win first. We've got to expand Wi-Fi all across the entire state, so we have greater access to telehealth. We've seen rural hospitals close here in South Carolina, and we've seen families have to go to the emergency room for just the most minor illnesses. And so it's turned some people's last resort into their first resort because their healthcare options have been ripped away from them because this governor has been focused more on politics. And expanding Medicaid, it's not only a moral issue in my mind, it's also an economic issue as well. I mean, we know that expanding Medicaid is going to save our rural hospitals. And we also know that it's going to create 40,000 new jobs in our state and inject billions and billions of dollars into our economy. When I was a member of Congress, I introduced the Medicaid REACH Act, which encouraged and incentivizes all the states, the 12 states that had not expanded Medicaid, to do just that. So taking whatever steps I could when I was in Congress to make sure that states like South Carolina would expand Medicaid. But we've also got to legalize marijuana as well and recognize, and we have a governor right now who does not even support medical marijuana. And I can't tell you how many people that I've spoken with who have had injuries or debilitating illnesses, and all they want is access to marijuana. And they've been handed a prescription for opioids, and they come up to me, it's like, I don't want to fill these prescriptions. I don't want to become addicted and become another statistics for this. All I want is access to what people in other states already have access to. And this governor doesn't support that. So we've got a lot to do in the realms of not only our physical health, but our mental health. And those are just some of the things that can be done for that.
Thank you, Representative. Well, Gary, how fast can you get this Medicaid expanded?
Day one. As the other Democrat candidates have said, I promise that as governor, I will immediately instruct the SC Department of Health and Human Services to apply for Medicaid expansion under the Build Back Better Act. This would cover the state share of expansion for 2 years, so the state budget wouldn't need to address this at first. After the first 2 years, the state match for those new enrollees would be 10%. Additional fiscal incentives become available immediately through the 2021 American Rescue Plan, which would increase the federal traditional match rate, the FMAP, by 5% for existing Medicaid population. I would also instruct SCDHS to hold that increased reimbursement aside. It's estimated that that increased FMAP funding would be enough to cover the 10% match after those first couple of years for several more years. So again, the state's budget wouldn't need to address this for probably 4 to 5 years. Remember that Medicaid reimbursement by the federal government is based on provided services. So the more newly covered South Carolinians that are utilizing their Medicaid, the more federal funds actually flow into South Carolina's healthcare system. With Medicaid expansion comes the benefit of a drastic reduction in the need for healthcare providers and insurers to cover the cost of uncompensated care, which is eventually paid for by increased healthcare premiums for all of us and also by employers who provide health insurance for their employees. Medicaid expansion will go a long way in addressing the racial inequity in healthcare that has become even more apparent during the pandemic. Not only will it bring health equity to hundreds of thousands of South Carolinians that will help them live longer, healthier lives, it will reduce the amount of defaulted medical debts, which is a leading cause of bankruptcy. So after those first few years, we talked to the private health insurance people. We talked to the private care providers that now have that reduction in uncompensated care, and we asked them to contribute the 10% match. That's how we'll do it. That's how we'll afford it, and we'll be able to do it without costing the taxpayers of our state a dime.
Very well organized answer, Jerry. Thank you very much. Okay, the next question is, as governor, how do you plan to address the lack of health care in rural South Carolina, which has resulted from the commercial consolidation of healthcare in our state? What steps specifically, as governor, could you take? And let's start with Representative Cunningham this time.
Thanks, Keith. I just want to commend Gary on that comprehensive answer on the last question, and touch on that real quick, that the federal government was covering 90%, and in the COVID relief bill that I helped pass out of Congress, we're able to kick in another 5% as an incentive. So the federal government picked up 95%, as Gary pointed out. And I tell people, think about what a great deal that is. That's like saying, if you give me a nickel, I'll turn around and give you $1. Anybody would take that deal, except for our governor right now. So I just want to illustrate that point. But as it relates to rural healthcare, as I mentioned, I grew up in a rural area, a town of about 500 people. The doctor who delivered me also delivered my 4 older brothers. So I know a little bit about it. And when I was in Congress, we would travel to some of these rural areas and understand the challenges that they face. And a lot of it is access to Wi-Fi. There's just not reliable Wi-Fi. And I've been on a 46 county tour where I've been to over half the counties in our state, crisscrossing the back roads. Oftentimes my phone goes out, the GPS goes out because there's no access to Wi-Fi. And it's a problem. It's a problem. It is a basic utility. And the fact that it doesn't reach every corner of the state, the stories I hear about, mothers who drive their kids up to the McDonald's or the Bojangles parking lot, and they park to use the Wi-Fi to download the homework, finish the homework, and then submit it before driving home, is just highly, highly discouraging and depressing. So that's got to be one of our focal points, is having Wi-Fi reach every corner of the state, but also investing in these rural health centers, having more community health centers that provide access to these areas, and also, have transportation services as well. I went on a ride along with a volunteer transportation service at the Medical University of South Carolina, and it was focused towards veterans, going out and picking up veterans, because so many people miss their appointments because of the basic need of transportation. They don't have it. So that's a big part of it. It's not only just about making your appointments, it's about keeping them as well. And we take for granted the people who don't have access to public transportation or transportation to their appointments. And I'll go back to touch on the what I said earlier about the rural Wi-Fi. We got to be looking at Wi-Fi as part of the infrastructure. It's not just roads and bridges, not just concrete and steel. This in 2022, almost caught myself saying 2021 there, but in 2022, we got to be looking at Wi-Fi as part of infrastructure as much as concrete and steel is. So,
Well, thank you, Joe. Gary.
Rural healthcare is a very important issue to me. First of all, I'd meet with the SC Office of Rural Health. They already exist. They've got a significant number of staff people. I'd want to learn more about what they do and how I could help them. My research shows that they have a meagerly funded grant program that they administer, and I'm certain that needs to have more adequate funding in order for them to be more effective in their mission. I'd also meet with large healthcare providers in our state to find out what incentives, like tax breaks, I could leverage to get them to invest in more rural healthcare facilities. Perhaps increasing the provider reimbursement rates for Medicaid in rural areas would be a viable option that would entice them to establish more rural healthcare centers. I would instruct SCDHS to find out from the federal government if that would actually be legal, if it's something that we could apply for a waiver for. And if that was a reality that we could actually do, I would push that through. As hundreds of thousands of South Carolinians acquire health insurance through an expanded Medicaid program, it's vitally important to give them a place where it's convenient for them to use it to get preventive care. And even just as important is develop relationships with primary care physicians. A lot of the vaccine hesitancy we saw during this pandemic is from people that don't have established relationship with primary care physicians that could give them accurate information as opposed to what they hear on Facebook or social media. So that's vitally important on a lot of levels. Telehealth or virtual visits are certainly appropriate options when it's appropriate, but in underserved areas, mobile health clinics that can provide diagnostic care and a basic level of treatment like medical reviews, med reviews, would also be an option that I would want us to explore as a state. It wouldn't be as dependent on people having access to healthcare online, but it would bring it to them basically on a regular basis. If we can see the mammogram vans and things like that that make the rounds through the urbanized areas, we can actually ask the private providers that are running those things to just get more focused on getting them out in the downtime to the rural parts of our state that need that help. But again, everything comes with Medicaid expansion. Giving 300,000 people Medicaid creates a market for those private healthcare providers to want to serve so that they can make a profit. And that's what we'll do.
Thank you, Gary. All right. Now, as governor, will you prioritize healthcare needs over other uses of the federal COVID relief funds? I'm referencing McMaster's attempt to divert money to private schools. Shall we start with Senator McLeod?
Sure, absolutely. I will prioritize healthcare. Was that the question over the current priorities?
Yes.
Okay, certainly. I mean, that's a no-brainer. We definitely need to prioritize healthcare, and I didn't get to speak to the rural piece, the rural question that was just asked. But I will say that we know that expanding Medicaid will help to reopen up hospitals in our rural communities and will bring healthcare providers back to South Carolina. We've lost a tremendous number of healthcare practitioners in our state. We know that expanding Medicaid will create an amazing economic boost to our state, which is why so many Republican governors have already done it. Here's the thing, diverting money, before we get to the diversion of money, federal funds, we have to address the fact that we have a governor and elected Republicans in this state who refuse to accept federal money and who refuse to use it for its intended purposes. I will speak to the fact that even with the American Rescue Plan money, when that money was slated for South Carolina, we have 253, I believe, small cities and towns in this state. When that money first came to the state from the federal government, only 17 of our 253 small cities and towns were able to access that money because the governor refused to request it. And that's all he could do. He couldn't change the amount. He couldn't change the designation where that money went. And he sat on it for months. And that was money that could be used to help South Carolinians, especially in our rural communities, continue to recover from this pandemic. It can be used for broadband. It can be used for teacher salaries. It can be used for any of infrastructure and healthcare and vaccination rollouts and anything related to this pandemic that obviously puts our rural communities further behind and more at risk, more susceptible to this virus, they could use that money for. So I was the only legislator to write the governor openly and ask him to just request the money. So as your governor, I will certainly request the money that is coming to our state to help our citizens from the federal government. I will also make sure that that the people of South Carolina are always covered when it comes to the federal money. I won't divert it. I won't divert money that is slated for public education and try to send it to private schools. I've always been a fierce proponent for public education and for healthcare and for anything that will benefit South Carolinians. So it's just so disheartening to watch a governor who cares nothing about the citizens of this state. So I think before we talk about diverting the money, we need to talk about accepting the money and using it properly. So I will definitely do that as your governor, and that money will be slated to address the needs not only in rural communities across South Carolina, but in all to benefit all of the citizens of South Carolina.
Thank you. All right. I've managed to lose track of who's answered this question. Joe?
Yeah, I'll hop on here. Look, I worked to pass that COVID relief bill, and so that when McMaster tries to divert those funds for areas in which it was not intended, like taking it to private schools, I've had to call him out in that and highlight the hypocrisy that exists with him. I mean, we have a governor who criticized all this federal money. You know who's first in line cutting ribbons and taking credit for some of the projects that it's funding? It's Governor McMaster. And we have got to do a better job of calling that out, that these are dollars that are funneling in here through only Democrats getting things done. And so for him to be running around the state trying to take credit for a lot of these initiatives that he opposed, I mean, it's the height of hypocrisy, and it's what you expect for somebody who's been a politician in our state longer than I've been alive, literally. And that's what happens here. So we've been calling that out since day one. We're going to continue to call out that hypocrisy and give people a strong contrast this year.
Thank you. Gary, would you like to address that?
Sure would. The federal COVID relief funds were designed to mitigate the impact of the COVID pandemic on the people of South Carolina. Governor McMaster politicized the use of this valuable federal resource just to enhance his reelection as governor. He diverted the funds to support private schools, and now he's trying to use them to speed up highway improvement projects to increase visitation in tourist-supported areas of our state. And he's consistently showing us once again where his only allegiance lies: to the donors and people that vote for him. I'd be using these funds to improve our underfunded school systems, enhance their ability to operate safely during a public health crisis with projects that would range from improving the ventilation systems to making sure that we're providing adequate personal protective equipment to teachers, staff, and students. I'd be using those funds to increase the number of testing facilities and vaccination sites. Right now, DHEC just announced today there's a 5-day delay in some of the tests that were done last week, and they just dropped it out on Twitter. Like anybody's even going to know. They said if you were tested on this weekend and you haven't gotten your results yet, come back and get tested again. And our governor keeps consistently saying, oh, we've got this under control. No need to worry. I'm worried. I'd be providing that with that money. I would have been all along providing vitally important mailed shipments to every South Carolinian, like reusable masks and hand sanitizer and now home testing kits, because I'd have had a mask mandate in place. I would have continued the state of emergency that was in existence before. And we'd be turning that mask mandate on and off. If the numbers were going down, I'd be okay with letting people be a little bit more casual about it. But when the numbers are going up like they are right now, we're about to break 30% on infected rates. 30%. And he still is refusing to mandate masks. Of course, he's going to try to use federal COVID funds for something other than a pandemic. It's what he does.
Thank you. Great summary too. Oh, okay. And this is a question I am personally anxious to hear about. When elected governor, do you have any plans to address structural health issues such as food deserts? And let's start with Gary.
Sure. Food deserts. This is one of the causes of hunger in our state. It leads to food inequity, increasing the travel time required to purchase groceries and domestic goods. It has a disproportionate effect on the health of lower income people that have limited or non-existent transportation. We need to provide tax reliefs to supermarkets who are willing to locate in underserved areas. I would be exploring that as an option immediately. Increasing SNAP availability would be another option. But more importantly than just increasing the availability or the amount of SNAP benefits that we give to people of low income, we need to let those recipients use those benefits to purchase groceries online and have them delivered, just like the rest of us have had the luxury of doing during the pandemic. I'd also increase community level distribution of surplus USDA food in those areas. When I was younger, I've been on Medicaid and SNAP in 3 different states throughout my life. I've been on disability for 20 years. I have very fond memories of standing in line back home to get orange cheese by 5-pound blocks for free. I don't know why we're not doing this now. We know the surplus exists. We just have to tap into that. I'd support funding, actual funding for food banks and distribution sites. These are interim solutions while we look for long-term solutions. As Desmond Tutu once said, it is not enough to keep drowning people out of the river. We need to go upstream and figure out why they're falling in. And that's something that's going to shape my time as governor.
Thank you, Gary.
Welcome.
Thank you. Joe, what do you think you can do about food deserts?
Appreciate it, Keith. It's ironic you asked that question. Just a couple of weeks ago on our 46 county tour, I was up in Calhoun Falls meeting with the newly elected mayor there, Tarico Holland. And Calhoun Falls has only a couple thousand people in it. And I asked him, I said, Mayor-elect, what's the number one issue you have on your agenda? You know what he said? Getting a grocery store. Getting a grocery store in their community so people don't have to drive miles and miles and miles away. And it struck me, it's kind of like deja vu, because I do remember in the small town that I grew up in, I do remember our grocery store closing and having to drive to the next town over, and how impactful it was for a small community. And when we look at businesses closing, whether or not it's groceries or otherwise, the 2 building blocks, obviously, of any community, everything stems back to healthcare and education. And unfortunately, South Carolina has been at or near the bottom in both of these. We've got, by expanding Medicaid and improving healthcare, we can address that. But by paying our teachers more and putting more money into our public schools, we can address the latter as well. You also have to address the infrastructure as well that will welcome businesses and help grocery stores expand into some of these communities. And everything you want to know about our state's infrastructure, you can look at I-95, which runs the entire eastern seaboard from Maine down to Florida. And the only state where it's 2 lanes is right here in South Carolina. This governor has no concerns about rural communities because he's been shutting down the hospitals and shutting down the grocery stores. But all these come back to, healthcare and education and infrastructure. And we got to address these issues because what may seem, minimal or minor to some people, access to a grocery store, is actually a very, very big deal, especially in some of these rural communities. And we've got to address it.
Thank you. Mia, please, if you could get to a quick wrap on this so we can close out the session. And what we will do is forward many of these questions that we've received in the Q&A. We'll forward them to all 3 campaigns so people can address them. But
Sure. Basically, I mean, how can we thrive as a state if we can't provide food and water, the most basic necessities, to our people and our communities? We have food deserts all over the state and a water crisis in Denmark. So right now we aren't thriving and we're still grappling with this pandemic. But I believe we can. We just have to do things differently. In today's social climate, with COVID-19 and all the other challenges we're facing, food deserts are indicators of more than just socioeconomic injustices. They indicate public health and safety concerns for those who are living within our borders. Residents with a chronic lack of access to adequate food resources we already know across the state, we're dealing with higher incidence of diabetes and obesity and cardiovascular disease. And it has a rippling effect because this pandemic is wreaking havoc on those who have underlying conditions just like that. And we're seeing our lines at Harvest Hope and other food banks quadruple from this time even last year. So the problem is getting worse, not better. I introduced a bill when I learned during the pandemic that South Carolina residents, our state is the only state in the nation to deny SNAP benefits, temporary assistance benefits to those who have felony drug convictions. And what's going to happen when formerly incarcerated people aren't able to get food and water and survive? They're more likely to commit more crimes so that they can eat and so that they can keep a roof over their heads and over their families' heads. We can change all of this, but we need a governor. The governor's job is to protect the lives and livelihoods of our people. We need a governor who is willing to do that. I am that governor. I am that person. I've shown time and time again that I'm determined to fight the status quo and to break through all of the ridiculousness that we are currently experiencing with our Republican majority, because they don't care. Everything in this state is contingent on an individual's zip code. And until we really address the fundamental changes that have to occur for all of us to thrive, nothing is going to change. So that's my take on food deserts. I can see the problem is getting much worse. As I think Gary mentioned, we are right at 30%. We have a 30% positive rate. Just a couple of days ago, we had over 13,000 people who tested positive for this virus. So as the lines quadruple for testing, and hospitalizations increase, we're also seeing people who are struggling to eat and to find food that they can afford.
Thank you, Senator. All right, I have to apologize to the people who submitted so many good questions online. And we've posted the websites, contact information for all three candidates. I'd like to thank all three of you for a great session. And I'm going to turn it over to Hal to wrap it up.
All right, thanks so much, Keith. Let me see if I can get the slide deck back. I don't think people need to actually see me. It was great seeing the candidates, but and you, Keith, and obviously the incumbent senator, the former congressman, and Gary Votour. I think there we go with our screen share. So I just want to let folks know about a couple of quick ways to get involved. One, we just say, hey, get involved with, Our Revolution South Carolina, if you're not already. And being on this call is the first step. We could not appreciate more this great, sizable group of people who are on. Email ourrevolutionsc@outlook.com, and we'll get you right involved. You can obviously contribute at ourrev.us/scmem, ourrev.us/scmem. I put that in the chat. We do have an action in Hendersonville, North Carolina. I know this is south. I know there's north and there's south, but it's not that far over the line, especially if you're in far west South Carolina. I've done the research. I don't know what the weather's going to be like, but if possible, I do know what it's going to be like. It's going to be clear but cold on Monday. If you can make it, if you're interested, we'd love to see you. Keep insurrectionists off the ballot. That's going to be Monday, 3 to 4 in beautiful Hendersonville, North Carolina. ourrev.us/Cawthorn. We're at noon on Monday. We've got a great call. ourrev.us/Monday, 8:30, 9:30. We'll be talking about that action to keep the insurrectionists off the ballot with John Bonifaz, Representative Ro Khanna with us as well. ourrev.us/Monday. That gets us to the end of the call. I'm going to do one call. You respond. When we organize, we win. Let's try it again. When we organize,
We win.
all right, everyone have a great evening, a great afternoon, and we'll see you soon. Take care. Bye-bye.